what's happening in alcohol now is a product of the globalization of the industry, massive, very powerful transnational alcohol corporations with no regulation on what they're allowed to produce, in a situation where increasingly governments don't have as much power as they used to put in place legislation and regulation to protect the health of their populations. And we know that in many countries, the people who are drinking the most and suffering the most harm from that are the people who are most disadvantaged to begin with. So it's an issue of inequality as well. So I think it's incredibly important. Well, we're working in a big international project. We've now got 13 countries taking part. It's about alcohol policy. And what we're doing is we're asking the researchers to identify what's happening on the ground, what the alcohol environment is like. Things like the licensing processes, how much tax is being paid on alcohol, the marketing, so what's the industry doing? Are they marketing widely throughout the community? And the other part of it is that we're doing a survey of drinkers, and we're asking them very detailed information about what they're drinking, how much they're drinking, where they're buying from and where they're drinking, what prices they're paying, and their response to the marketing. And the whole point of this is to try and identify what kind of policy change might make a difference, might actually reduce alcohol-related harm. We know that in our country, like many other countries, about nearly half of the alcohol consumed in New Zealand is consumed in very heavy drinking situations. Most people would agree that it's a really major problem. You know, we've had the Law Commission report in 2010. They were very clear that this is something that New Zealand really needs to address and needs to address differently. The government has responded by putting in place a new Sale and Supply of Alcohol Act, but many people in the public health field would say it hasn't gone far enough. One of the key issues is about marketing, because what marketing does is really tell people at large that alcohol is just an ordinary commodity. It's a very positive commodity, it's a fashionable and a glamorous commodity, and young ones are seeing this from the very beginning of their lives. And this is not helping us in terms of reducing the alcohol-related harm. I think the other issue is the price. You know, the cheaper it is, the more easy it is to afford, then we know that there will be greater harm. So we really need to see some changes in those areas. It's absolutely crucial that we get good quality alcohol research which can inform people who are then going to advocate for change, for good evidence-based change. And this can inform policymakers and help them make good decisions. But it is important that it is there for advocates to use, and particularly important in an area like alcohol where the vested interests are very powerful. They've got many resources, they're very good at creating misinformation and lobbying very hard against effective policies. So I think the need for research which gives us really good quality evidence about what kind of policy changes might make a difference, it's really, really crucial. You know, alcohol contributes to 60+ diseases. It affects the drinker, him or herself, but of course it also affects the people in the drinker's family and the wider environment. And of course it affects the taxpayer, because they pick up the tab when it comes to alcohol-related harm in the emergency department, in the hospital system. Loss of productivity is a really big one. So actually reducing the harm from alcohol will really have widespread benefits for everyone. But you know, to be honest, my concern is not only with New Zealand, although that is very important. I'm really concerned, and the reason why we built the research platform that we've built, I'm very concerned about the developing economies, which is really where the alcohol industry is putting its focus. So just as tobacco actually stabilised in the high-income countries, alcohol's done the same. So the transnational alcohol corporations are looking for new markets in these developing economies. And in these places, they have very poor policy, very little policy in place, and this is where the industry is putting its efforts. We're seeing an expansion through the community of drinking very fast into the sector, young people in particular, encouraging women to drink more, but also men, the usual consumers, most heavy consumers of alcohol. We're seeing traffic crash, alcohol-related traffic crash zooming up, alcohol-related violence. I believe that alcohol really is exacerbating poverty and a lack of development in a lot of these countries because of the way in which it reduces educational achievement and also affects productivity. And it means that there's less money in the community to do the sorts of development that is needed. So that you know, it really is a question for me of, can we provide a research opportunity, a research platform, which gives researchers, alcohol researchers in these countries who are quite new to alcohol research, a very sophisticated way to move forward. So we're helping people around the world, and I think the HRC is really to be acknowledged for what they're doing in this regard.